Hi, I'm Charles Lee. I'm an internal medicine physician and past National Library of Medicine Fellow in medical informatics. I am Senior Director for Meducation, which is a patient-centered communication tool that addresses low health literacy and language barriers. My role at FDB is to focus us on patient-centered communication to make instructions much simpler for patients to read and understand, particularly around their medication instructions. My philosophy on patient communication is that we can't really expect to give the types of document we give them now and expect patients to figure it out. We really need to give them things that are simple for them to follow, particularly around their medications, to reduce medication errors and improve adherence. During my medical training, I found that there was a need to improve communication with patients. And growing up, I always wanted to build things. And with my informatics background, I felt there was a role that technology could play in making these types of language and health literacy tools accessible for our healthcare system and patients. During my medical residency training, I visited my grandmother, who is Korean, and I discovered that she was receiving medication instructions that she couldn't read and understand, and actually had somebody in her apartment complex translate for her. So the challenge around medication safety for our limited English proficient patients is a tremendous one. The reason I'm so passionate about this topic is that there's about 30 million people in the United States who don't speak the English language. These people are at high risk for medication errors. And if you really think about it, the patients who need the most help are the ones who have struggles with the English language and health literacy. Meducation fits FDB's mission to improve health through medical knowledge by directly addressing the consumer needs for medication instructions that they can actually read and understand. So we're trying to provide actionable information that is simple for patients to follow, leveraging informatics behind the scenes. One of the things that I really enjoyed about coming to work with FDB is the great team of dedicated professionals here. We have fun all the time, and I'm not just saying that. We really do enjoy working in a collaborative environment to improve healthcare for our patients. Yeah, if I was giving advice to somebody getting into this field, one of the things I would say is, have as much diversity and experience as possible. By having these types of different experiences, you're going to bring some innovation into and bring new ideas into the way that we approach things. Solving problems require us to think in a different way, and making that contribution, I believe, requires you to have lots of different experiences.